we come from with our personalities? We've got an excellent authority on the subject, Dr. Catherine McCarthy. She is a child and adolescent psychiatrist. She practices in McLean here in Fairfax County. And we're going to talk about, one, some of the neurobiological issues relative to the development of the brain. We're going to talk about some of the issues that we commonly encounter with kids and help you understand what they go through as they go through the changes and why they may not think exactly like adults expect them to think. And we're going to take some questions that actually some families have posed to me that really I think I'd love to get some insight and input from Dr. McCarthy on. So thanks for being with us.
Thank you for having me. Thank you for having me.
Of course. Now, one of the things that I was inferring here is that the brain, as it develops, really has a lot to do with what we see with kids as they go through, well, from the earliest phase to their adult phase.
And that information neurologically, radio imaging wise, looking at the structure of the brain, how it develops from early on, going up to even into the 20s, that information has changed dramatically, especially since you and I were in medical school. When you and I were learning to be doctors, we thought that there was this, and we knew a period of this exuberant growth, and that's when kids would acquire language, learn to walk, all that amazing stuff that happens in the first 2 years radically, and why when you take a picture of a kid early on or a video, 3 months later, they've changed so much. And we thought that after that growth, brains got a little bit bigger. They were almost the same size, actually mass-wise, as they were when they were teenagers, but not a whole lot new stuff happened. And that information has changed dramatically thanks to the work of a brilliant physician at NIH named Dr. Jay Geed, who in the past decade has completely turned around the way we look at the teenage brain. And one thing that's really important when we look at teenage behavior is the fact that after that growth and as a brain develops, when you get to the puberty time, sometime between the ages of 11, 14, the brain starts to have this massive connections or arborizations. There's this period of thickening of the brain, of the outside of the brain, and then thinning. And you can literally see it. There's some wonderful places you can look on the internet to see this massive change that happens. And most importantly, the last part of the brain to develop, we thought was all developed, and nothing really changed, by early adolescence, actually doesn't fully to develop till the ages of 24 to 29. And that has turned everything of how we look at teenagers and what we should expect of teenagers and how we communicate with teenagers and how we are able to, help guide them and influence them upside down in the past 10 years.
Wow. So it is a fascinating thing because we basically would learn theories of personality and fairly concrete expectations on how people go through that. And if they were a little bit different, we just would correlate it with other influences that really didn't have an anatomic basis. But now you're saying that we have been able to observe literally down to the cellular level exactly how the brain is evolving and how that does correlate with the different behaviors. Now, babies literally at 3 weeks after conception start to develop nerves. Their central nervous system starts to organize in that little neural tube, as they call it. How far back do these traits and trends start to demonstrate some ability to impact them further down in development?
Well, that's a good question. And I think, whether you're studying anthropology or field of medicine, the balance of nature versus nurture is one that physicians and philosophers can discuss for 24 hours straight without breathing. Early on, clearly our genetic makeup determines how our brains develop, and there is certainly a lot of marvelous researchers, especially Jeremy Kagan up in Boston, who have looked at how temperament early on and those wired-in traits tend to follow someone into adolescence and into adult life. You can literally videotape some of these kids, especially the socially inhibited ones, in those first 2-3 years of life, and be able to predict some of the traits they might have later on when it comes to shyness or social anxiety. Not guaranteed, but at the same time, this new data about, or relatively new in the past 10 years, about brain development indicates that there's probably windows of opportunity where what kids are exposed to, the way they interact. And we certainly know socially it's so important from age 7 on, even earlier, what's in a kid's environment. But actually, the brain responds to the environment, and there's some theory now that the brain could mold this way.
So, and I would love to go through this segmental development of the brain and sort of correlate it with what we see behaviorally in kids.
Right.
So I know that, so we go through this fetal development where really initially all of those parts of the brain that help to guide our heart rate and our respiratory rate and the reflexes that allow us to have sensory motor, function to be able to ultimately walk and all those sorts of things start to become a part of us. And then when we're born, do we have more neurons at the time that we're born than we ultimately do as adults?
We do. Over time, it's not just the number of neurons, because yes, certainly with development, things are pruned as kind of like you look at, pruning bushes of a tree. So it's not necessarily the number of neurons to back up the nerve cells, but there's some changes in the numbers, but it's more the connections that are made between the nerve cells that change over time, and evolve over time. And there's this part of what's called exuberant growth, this period of exuberant growth that happens, early on from, infancy going to 2 years, and then this pruning of the different nerve cells and connections that leads to changes in behavior. It's hard to say exactly what causes what. We're not quite there yet, to my knowledge, but there's changes in the thinning and the thickening of the connections.
And I'm going back to that early phase because it's so important to me, because to me it means something to me, because I see babies when they're born and they have very primitive and very rudimentary instincts. Whether it's a reflexive hand grasp, whether it's focusing in on eyes, whether it's quieting when they're soothed or talked to. Those, when we look at the anatomy, they represent a very primitive part of the brain. Yet we as adults look at them and impose our cognitive expectations. You're responding to me. When I put my finger in your palm and you grab it, it's really an instinct, but I don't think so. I think you're grabbing it because you want me close to you.
That's true.
And when I soothe you and you quiet, it gives me that nurturing feedback, that reinforcement. And I see that as the way that the personalities start.
And well, the interplay between a baby's world, an infant's world, and the environment, and being able, to have that child, react to you, turns on something in you that makes you want more, and you engage more with your kid. And this period, this window of opportunity is, so critical when it comes to attachment. And what's so frustrating for parents when you move ahead to adolescence is that all of that seems to go by the wayside when they don't want you so much. Even though they still keep coming back, they keep on wanting you, just like a little toddler moving away, and they want to come back.
So we see, of course, as you were saying here, there is this period of time where they start to acquire the social input. They come out fairly reflexive, fairly, ready to suck and swallow and sleep. And gradually they start to smile in response to smiles at them. They are sort of pre-wired to have some way to garner your
attachment, your connection.
Right. And by your feeding them back, you're creating a trust and a substance that they start to then organize into, I guess, the part of their brain that's developing. So they come out, they have all those potential areas of the brain that are working. Tell us a little bit about the parts of the brain that we understand, and sort of sequentially how they evolve and what they mean in terms of what we watch in terms of behaviors.
Well, probably most relevant to teenagers, and even if when we look at toddlers, in controlling our impulses, since that's one of the bigger concerns when you look at teenagers in high risk, is the development of the very front part of the brain, what's called the prefrontal cortex. And it's the part of the brain that's one of the most recently involved when you look at evolution. It differentiates us in size from other primates. And it's the part of the brain that helps you see cause and effect, to be able to think before you act, to inhibit your impulses. And when you look at a 2-year-old, you know, in the candy aisle is always the example that people use, and he sees all these bright colored candies and everything. One of them shakes, and one of them, you know, he found out tasted sweet. He just grabs them because he's got no filter. And all of us, when we see things we love, actually still have some urge in us that we just like that, you know, and some of us control it better than others, and I'll get to that. But with a little child, they don't have that filter. They don't have that maturation of the front part of the brain, and they are a lot of impulse, just in the moment, and that's why they require so much care. You don't let a child walk into the grocery store and wander around until they are a certain age and they have more of that, what's called prefrontal cortex development. And since that is the last part of the brain developed, not to jump ahead too much, it presents problems in adolescence. But that's one of the main things we see. And we also look at that part of the brain is the part of the brain that helps you see the gray in things, not black and white. So looking ahead to more 7, 8-year-olds, when they come home from school and say, you know, so-and-so didn't play with me on the playground, she's not my friend anymore. Or, you know, I wasn't invited to this birthday party, I have no friends. That black and white, instead of, you know, an older teen or an adult who has more maturation in that front part of the brain that's able to say, well, I have these other friends, able to see the gray, not in these black and white, what's called the, you know, the concrete period of development, is largely due to that part of the brain. It's so complicated to put it on one part of the brain is too simplistic, but that's important.
So, and as I understand, in the developmental progress that the brain goes through, so we start with that basic primitive reflexive state that is there for survival. Yeah. That's the most solid, resilient, and strongest part of the brain. And then we have this more intellectual and social and cultivated cerebral areas.
Yeah.
And when babies are going through that transition, they are starting to create circuits through their experiences that then start to get reinforced in ways, and as that's happening, they have other maturational events going on, like myelin and the way that we speed up these circuits. And
right.
Once we're sure we need a circuit, we dedicate it and we make it work as fast as it can.
And that's been shown. It's fascinating stuff with the more recent imaging and brain research, is that the more you use certain areas of the brain, you can see what's called, what you refer to as the myelin, the sheath around those nerve cells. And just like if you think about electricity, we need to have an insulator to make an electrical circuit go. The thicker it is, so the thicker the sheath is around the nerve cells, the faster they go. And by using it more, you get faster connections, whether it's for thinking or for in the language circuit or for motor control. When you see more myelinization of the spinal cord, kids learn to walk. We can't speed it up by giving them walkers. So you know, that's a very important point.
It's huge, and when I think of myelin, I think of, okay, so a great example is walking, where you have that neuromuscular feedback. So you feel where you are in space, and you can send the messages quickly enough so that you get the feedback, and you get the feedback out to the muscles in a way that will allow you to walk. And until you have enough myelin to make those impulses go quickly, you won't be able to do that. And the same thing sort of goes with a toddler, but this is in what we call the white matter versus that gray matter. As they're developing those internal pathways, how to respond to voice commands, for instance.
Right.
You ask someone to put something down, and they're 18 months, they don't quite understand. If they're 24 months, they may understand, but it still takes some 2 minutes, 3 minutes to put it down, and you wonder, why aren't you listening to me? Well, that pathway hasn't
been fully matured.
Hasn't really matured that way.
Yeah.
So when we see toddlers in their tantrums,
It's all impulse, all and in the moment. And that's why you cannot reason with a toddler. You know, when I look back at some of the, you know, fascinating psychological texts that I looked at that were written years ago before this brain research was there, a lot of it was about processing feelings with a toddler, you know, listening to them, you know, really allowing them to feel heard. And I, you know, think back to when, you know, one of my kids was, you know, very upset because they couldn't get something at the store they wanted. I want that Lego, I want that Lego, I want that Lego. And if I were to say, are you so sad because you want that Lego? You're so sad, and processing it, they're not going to get out of that moment because they're only in the present, not able to think sort of beyond the next step, and slowly, you know, learning them, teaching them to be able to transition, to change, you know, their interest, move on is part of the job of parenting, to be able to shift sets.
Right. So, and it's in that period of time you were saying where they arborize, or when we talk about arborization, the nerves are all there, 300 billion of them or whatever, at birth.
Yeah, yeah.
And then they start to develop these little connection branches. And that's the arborization.
And that's the arborization. And then what happens, although this is complicated, yeah, so that they can communicate, and so that, and when you're exposed to something, whether it's hearing a language, there's more connections made, and that is sealed for life. And that's why there's these windows that we've all heard about, that you need to hear a language if you want to be able to understand every little sound, whether it's, you know, in Chinese, which I didn't hear when I was younger, but there's some sounds that if we don't hear by a certain age, you know, by age 2 or so, we will not make those connections, and that maturation of the brain will not happen. And no matter how much we study, if we get a dissertation in that language, we're not going to be able to hear those sounds, because that window, and when that pruning happens of the brain, closes.
Yeah. So toddlers, when they get frustrated, when you say that they can't get their way and they throw a tantrum, and we're sort of helpless, we try to reason with them. Doesn't work very well.
You want them, you don't want to ignore them and just, you know, like they're not there, because they need to know that they can have an impact with their language and with their needs. You know, it's not negligent parenting, but it's not this over processing it on and on. It's teaching them excellent coping skills for the future, that all of us can be upset about something. It's hard to teach that you find a solution, but the solution that you find is trying to get them to shift or find something else to be able to get unstuck. Staying stuck in a tantrum, it's not that you have to be phobic of tantrums, but it doesn't help.
You're telling them to stop is pointless.
Telling them to stop is pointless, because they'll just get more upset.
Right.
Yeah.
So first avoid.
First avoid.
Make sure you know you're not going to the restaurant with a 2-year-old who's just not going to be able to cope with having to order and wait 20 minutes for the food to show up.
Right.
You're not going to expect them to be able to contain their frustration or their desire to explore. That's all autonomy, and that concept of autonomy, I can do and therefore I will do, and somebody's holding me back, that seems to be the parallel that we see in toddlers with teens.
Absolutely. It's what the old school psychiatrist, I shouldn't say this, but traditional, more, you know, psychoanalytic school, but yet is very relevant today, called separation individuation. And it's when you see this in toddlers, it's when you see this 3-year-old at the mall who does venture off because he sees something a little interesting, but then all of a sudden he thinks, oh my goodness, where's my mother? And he comes running back. But he keeps on trying a little bit further, and that's exploring his world, making all of those neat connections, finding things that they love, but then scurrying back. And that parallel exists again in teens, although it looks completely different with teenagers.
So as we watch those kids go through that period, they have all those neurons at first, they're very primitive, they're very responsive to all the input. Nurturing is a very important thing. Soothing is something they can feed back. It's instinctive. And that connection, that trust allows them then to be brave enough to go out and to try things. Of course, then you have to set those limits. They get frustrated. They don't know how to deal with that frustration. They don't have the higher cerebral areas to be able to cope and to delay gratification, to feel comfortable with not being able to get what they want. And they just fall into that screaming or kicking or screaming and kicking episode, and we say we can avoid those situations. We can try to distract them into
Right.
something else, and of course we can ignore them and hope it goes away,
Right, right.
which it eventually will, as
eventually
they
will.
realize. But there is that period of time where there's, through all of this, they're really narrowing down their ability to cope. Now, when kids have bad tantrums and don't seem to be able ever to find ways to quiet, or you can't find an effective way to help them cope so that they can move on from that
Yeah.
tantrum, what does that represent? Does that represent some concern for some psychiatric issues that might be evolving?
It can be. It can be. Again, we have all different temperaments and different levels of emotion regulation, and sometimes it's a matter of not having that smoother emotion regulation that happens with maturity happen. If you're, really concerned about a child's level of suffering, ability to calm themselves down, one should always talk to their pediatrician about it.
Right.
Yeah.
So sometimes it may
Sometimes it's too
represent
much.
something.
Yeah, absolutely.
And of course, through all these periods of time, so we were talking about nurture and nutrition too, all those kinds
Yeah.
of environmental influences and things, certainly while they're in utero, they need a lot of protein to grow all those neurons in those tissues. Mom needs to be eating healthy. She does drugs or has some other kind of insulting encounter with an infection, medication, a substance of some sort, if she's really taking alcohol.
Right.
And we see the results.
You can see it, and I mean, I haven't read the most recent pediatric literature about fetal alcohol syndrome, but there's, from my understanding, a very important window of time that's very early on that can really destine a child to having some disadvantages when it comes to emotion regulation and certainly intelligence and ability to manage.
So those cells are all very important. And then the genetics.
Yeah.
When you have a family where there is a lot of, let's say, emotional dysregulation, and they have a child with emotional dysregulation. So you have a toddler who's throwing these tantrums with a parent who never really learned how to control their tantrums. And that would be common.
It's common because first there is heredity working against you, because a lot of these traits or emotion dysregulation or even mental illness are highly genetic. What is such a hard thing for parents to hear, because a lot of these parents are almost, they're trying to be superhuman. You have a very difficult toddler or evolving into a difficult child, difficult teen that presses your buttons, that takes all your reserve. And if you have depression, if you have some mood challenges, a lot of anxiety, it's hard to be superhuman to be able to contain it. But it's really important for parents to ask for help then, because a lot of the data supports that we don't cause all the time mental illness in kids, but by having what's called high levels of emotional expression, psychiatrists call it EE because we have to use an acronym for everything, that can exacerbate a kid's own emotion dysregulation. And we know that high levels of cortisol, high levels of stress on the brain, we know this from the research of trauma or of kids who have lost a parent, their brains are bathed in cortisol, not just that, but other stress hormones and neurotransmitters, and that is not good for a developing brain and can lead to depression later on, certainly higher levels of anxiety. This time and this early development is critical for how the brain's going to regulate emotion later on. We can't be superhuman. We can't expect parents to be superhuman, but making sure that parents are able to ask for help, whether it's from other family members or from professionals, if they really are finding that they're sinking to a kid's level.
And I have to ask you, because you stimulated a question for me. So if, let's say, under the influence of certain hormones like stress hormones like cortisol, and we know that there is an association between high levels and depression,
Right.
And that there could be some predisposition for the fetus in utero to have that occur. Now, would that be possibly because it changes the concentration of neurotransmitters and the way the cells communicate with each other and which cells will communicate with each other?
Gosh, that's a really good question. I think it's so complicated because of all the other things that are. in our environment,
Hard to
whether it's,
isolate.
now there's some question of whether pesticides cause learning problems if someone's exposed to them in utero. I think it's really hard to tease out. The studies, to my knowledge, or that are looking at the effect of stress on a developing brain are looking, after birth, but we certainly know from alcohol, hands down, and from other things that can, get into the, fetal nervous system early on, that, the brain is sensitive and constantly changing.
And when we go through that sequence as you were describing, so you have the evolution of all those neurons in utero, in your fetus, and you come out, you have all these nerves that are ready and willing. There are certain instincts that they follow through. There are some experiences that get reinforced, but in those next few years, they grow all those attachments.
Right.
And then, so in the 2 to 4 year range of the first 2 to 4 years of life, they grow all those attachments, and they either use them or lose them, as you said.
Right.
They will then have those patterns, those pathways going forward, and the job then becomes one of understanding how to deal with them. So they hit that 4 to 5 year age mark, and those pathways are pruned down enough, as you were saying, to where they can operate and they start to master. And there's this nice little period of what they call latency, which is probably an archaic word to use for that period of time when they're in grade school and elementary school, but where they sort of work on physical skills, social skills, and generally do pretty well with their progression. But there are some that stand out. But at what point do we start to see the influence of hormones and what that does to the brain and its evolution?
Yeah, well, just touching on those special years, those pre-pubertal years that we used to call latency, and the reason psychiatrists call it that because they felt everything was latent under the surface. During those years, social interaction is everything. And although, we did see this exuberant growth and then molding of the brain early on, what is happening in a kid's world in those years is learning how to interact with the world, cope with other kids, develop good social ties, and learning all the skills personality-wise, they're going to make them effective human in the future. Personality gets you really far in life. And although there are those, genetic traits when it comes to personality, the experience kids have socially is everything. Effective hormones, I question you that actually, as a pediatrician, I do wonder if you start seeing that earlier these days than when we were in medical school and girls had, started to have their periods more in the 13-year-old range, and now we see girls having it more around age 11. Is that correct?
Well, it's still 12 years, 4 months, 5 months. That's the median age. That's the normal age. But you will see it anywhere from 9 to 17, but that's besides the point. But yes, no, it has gradually gotten earlier and earlier, and that's looking at large populations. And we do know that there are certain substances in the environment that simulate the sex hormones, whatever it might be. There's some, let's say, false accusations, but we know that there is that trend, and maturation and fertility certainly starts to show up earlier. And it's a little worrisome because I'm not sure if that correlates with the development of their judgment and their brain centers.
Brains aren't changing any to compensate for that. And, and so what, although, the child psychiatry is still a field in its infancy, one of the questions is, do you see with hormones, causing moodiness, in most humans, some of that happening earlier these days than it used to. There's not been large-scale studies to help tease that out, but certainly in my practice, which isn't a way to judge science, but I do see that there's more moodiness happening a little bit earlier in kids.
So what are some of the changes that go on in the brain at the time that we see them going through adolescence?
Well, you see the development, this period of what's called cortical thickening, and that's those connections, making more of them, all the brain cells connecting even more, and then a thinning. So it's actually what Jay Geed calls an upside down U-shaped curve. If you were to have on the x-axis age and the thickness of what's called the cortex, the mantle of the brain, you see this upside down shaped U that peaks for girls around age 13, girls around age 11, boys a little bit later, a couple of years later. So there's again this thickening in growth and then thinning of the brain as more connections are made. And one of the main areas we look at when it comes to change is that front part of the brain that I was talking about when we first started talking about brain development, which is the part of the brain that not only helps you with cause and effect, as I was saying, but helps you, tune out distractions, stick with things when they're boring, plan ahead, manage your time, be able to see cause and effect, as I said, being able to, as I said, see the gray in things, not think in concrete terms, black and white. And these skills are, critical when it comes to school. But then more importantly, it still is the part of the brain that helps us with impulse control and getting us into situations that could be dangerous so that we do not immediately do something without thinking about its consequences. So that is probably one of the most important things for parents to understand is this part of the brain is still changing. Now it's not fully developing. It develops in a way that it matures from the back part of the brain and ends in the front part of the brain when you look at that thinning. So the back part of the brain matures fastest, and then again, it's not till the ages of 24 to 29 that the front part of the brain develops. And that's where, if we look at rental car insurance companies, they have known for years not to rent a car to someone under the age of 24. It's not 18, it's not 16, it's not 21, it's 24, because that matches exactly when the rate of motor vehicle accidents go down, from my understanding. I'm not an insurance specialist, and kids are much more likely to not, speed as quickly, not just do things because it feels good. Also, this front part of the brain, relevant for our discussion today, does have some relevance when it comes to mood and regulating our emotions, so that when one bad thing happens, we don't just immediately blast off. So, for instance, today, if you woke up, you had a flat tire, you were a little late to work, then you had a family get kind of mad because they had to wait, and then you forgot to bring your lunch, you get a little more cranky. By the time you get home, you might be mad. When you're a teenager and have trouble with regulating your emotions in an immature front part of the brain, one little thing can set you off. Your mom forgot to make what you wanted in your sandwich, and you come home, how dare you?
She's an idiot. Yes, I can't believe it. Right.
So it's important with how we look at teenagers and what they're capable of.
Right.
And how we respond to them.
So there is that. Well, you're talking. It's funny listening to it. Of course, the prefrontal cortex seems to be extremely important in our higher intellectual activities, and what really does separate us from the rest of the animal kingdom. It also seems to be where all the traits of an attention deficit disorder seem to be located. And of course, I know that biologically and professionally, but still, it's interesting for our audience to hear that all those things are supposed to be going on, and that's actually the place where we try to focus our treatment, when either through behavior modification or the medications that actually impact the way the neurotransmitters work in that region.
Right.
So there are certain qualities in kids that we talk about, resilience, ways that they can respond to stress. Can you talk a little bit about that? And
there's marvelous new data about resiliency, and a lot of the researchers actually located in the DC area, Mary Alvord being one of the leading researchers, and certainly people at NIH. And one of the things that's really hard as a parent when you look at how to help your child become a happy and competent adult is how much stress you're willing to let them tolerate. And here I talked about how stress is hard on the brain, and so all of us want to go and have our kids never get stressed out. We don't want that cortisol in the brain. When in fact, teaching a child to tolerate levels of stress, to tolerate anxiety, and not to be fearful of it, and not to go into these worst case scenarios that, oh my goodness, it's going to be terrible if I don't get an A, but to be able to tolerate having some distress leads to resiliency, because in the end, for a lot of us, life can be really hard. Some people get off with an easier life, but generally speaking, most people have ups and downs in life. And part of our job as parents is to be able to teach that no matter what, you will be okay. And the anxiety, although it's unpleasant, can't hurt you. Right. It can't hurt you. Anxiety can't hurt you. Even in someone having a panic attack where their heart is pounding, 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 they get sweating all over, they're feeling dizzy, they feel like they're gonna throw up, they're lying on the floor, they're going to the ER because they think they're dying. That can't hurt them. It feels awful, feels like you're gonna die. Right. So although this is, not a discourse on just let your kids suffer, but finding that balance of allowing them to tolerate it, that we don't swoop in and fix it. If a kid gets a teacher that's, not the right fit, that's a nice way to say it, or even a teacher that's actually, more concerning. I shouldn't say this, both my parents were teachers, but and I very much appreciate every teacher in this county, but you don't swoop in and then tell the teacher how to teach, to the kid, or you didn't give my kid this grade, or you don't look at him. You let him deal with life. And there's different personalities, and maybe that's just not the right fit. Maybe you have a more sensitive child, and this teacher wants them to speak up, clearly in class, and gets on them for not giving eye contact. But we all have to learn to tolerate distress and see that somehow we'll be okay. And the resiliency data supports that.
Right. Interesting. There are so many things that you open up when you start to talk about that, but let me get to some of the questions now these are questions that I solicited from families that I take care of, and some of them are pretty interesting actually. One mother said, I think my child is getting on with a bad crowd. Had some suspicions that she was doing drugs or drinking or doing something, but could never really put her finger on it. Every time she tries to talk to him, he slams his door. He tells her, leave me alone. I don't want to deal with you. You don't know what you're talking about. Leave me alone. Yeah. I think that a lot of families go through this. They have kids who are getting into that age of autonomy, as we were calling it, that independence. I want to be who I am, not who you are.
Right, right.
And therefore, I'm going to do things that you're going to wonder, what am I doing? Well, I'm doing what I'm doing. I'm me. Yeah. But how do parents cope with that? I mean, how would you advise them to evaluate, number one, whether the kid is in trouble?
Right, right.
Number two, how would you advise them to deal with the child?
Well, this brings up the point of, even though that separating and individuating that we talked about in the toddler stage felt kind of cute and cozy, and how the kid would go off and then want to toddle back, it's actually really similar in teenagers, but just looks different. So here's this kid separating. I don't want you as part of my life. I don't want you as part of my life. And there might be more serious concerns, which we'll talk about. Right. But they still want you there. And we get this idea that because it looks so different, it doesn't feel like the cozy little 2-year-old, 3-year-old time. In fact, it'd be quite toxic. It could be that teenager is saying like really mean words or curse words, or I want to move out, that kind of stuff, or you're a terrible parent. All these things that really hurt us as parents. And how do we raise this child? But they still want us, and we gotta find what a great therapist colleague of mine that I respect, Barbara Cathras, says is the sweet spot, which is finding a way to find that connection still. And if we look hard enough with one of the parents, it may not be with both parents, sometimes kids will reject one parent, not the other, there's still brief moments where they will connect with you. And if that is on the drive to school, or if it's when you're driving them to the mall, when they're going to get something that they want, if it's when you're driving them, to buy a new cell phone, and they're being all nice and they're talking to you because they want their cell phone, that's your opportunity to start to talk to them. And whereas a lot of us as parents like, oh, he's only talking to me if he's getting something out of me, we got to take that, because that's the chance for them to come back and say, that they can say, you know what, I was dumped by this girl. Those are these small windows, but we start to take it so personally because they're becoming adults, and it is personal, that we aren't able to find those moments of attachment where you can engage. Now, in a kid like this, with the avoidance and with how prevalent drug use is in all areas, not just this country, but other areas of the world, it's important to be evaluating, is there something more serious? And one thing to look at is, say you can't find the sweet spot. You've looked everywhere, there's no place this kid is talking to you. Is there any other adult in this kid's life that has some connection? Is there a coach? Often they'll really get along with the coach as well, and they won't talk to us at all. Is there somebody in this kid's life, even a grandparent? Some kids, as awful as they can be to us as teenagers, will always always be nice to grandma. And they will sit there, and if she's not feeling well, sit with her. Anybody who can possibly connect with this kid to try to draw them out that you can talk to. You know, one adult is all it takes for a kid to give some information that could be concerning. Now, in kids like this, you've got to worry about drug use, and you've got to try to find a way of getting more information. You talk to their friends' parents, try to hone in on what's going on by communicating with other people that are in his world. Certainly depression is something that's of real concern, and you know, trying to get as much information as possible. This is the one instance, although we've got to let kids be separate and free and independent, where if you were really concerned about someone drug use, you might start looking more at their texts. You'd have reason for a search warrant. That's what I call it. If you don't have reason for a warrant, you do your best to give them that space. If you're really concerned, you're the parent, you still got to watch out for them.
Interesting perspectives for sure. Certainly when we see the kids and they come to the office, they'll ask, what should I be looking for? Well, of course, if your grades have changed, you know, if you were doing very well, then all of a sudden you're not. If your pattern of eating has changed, you're eating but only really late at night. You're not eating at the family meals. If your friends are changing, the people who you sort of were solid with, who played on your soccer team, you know, going through junior high school, all of a sudden don't have anything to do with you.
Yeah, those are big warning
Those are
signs.
big warning signs. And in that situation, the hardest thing to do is to impose your judgment on them. And where do they go at that point? I mean, obviously they'll come to me, they'll come to you, but what can the parent do to help in that situation? You were saying find someone to connect with.
Find someone to connect with, but also, you know, empathy. We have to put ourselves in teenagers' shoes.
Okay.
And if they're seeing someone as, not to make this about me, but that is a parent that's busy, often irritable, and usually has an agenda, why would you open up to that person? I wouldn't open up to a friend that was busy all the time, snapped with me a lot, and usually wanted me to do something. That's not the kind of person I want to have lunch with. So how can you put yourself in their shoes to make yourself the person that they want to talk to? Also, are you the kind of person that is telling them some things that make them feel good about themselves? You know, when we come away from something and we feel really good about ourselves, it's usually we've been, you know, told something sincere that's about. And I'm, you know, I have big issues about praise and just telling a kid they're smart, vague, non-specific praise, but appreciating something about their person that is good and decent, that allows you to connect more. But certainly, if you're not, one of the main things to watch for in adolescent depression in the warning signs is a kid not enjoying what they used to enjoy. And the only reason that came up in my mind is you were talking about maybe switching friends, the kids that they used to enjoy are not enjoying a sport, or just not even, I'll have kids that stop enjoying video games. Oh my goodness,
that
you know,
seems impossible,
and if they're not enjoying, and there's even some studies, and this sounds a little hokey, where you actually see a little twinkle go out of their eyes. But you know, there's a question of, are they? And this is not pure science, but you know, are the tear glands, you know, something going on with depression that you're seeing a flatness. And so if you're starting to see a kid that's not enjoying what they used to enjoy, that's a time to ask a health provider for some help.
And once again, looking back at yourself and your psycho-emotional state. I mean, there are a lot of people who are taking SSRI, Zoloft, Prozac, those sorts of things, and then don't understand why their child is acting that way. There is a genetic and a real biological predisposition for that to happen. And sometimes they create an environment where that is realized more than they are aware. So they need to be linked into that. Interesting stuff. Another one, my daughter is a junior in high school, and she used to hang out and have fun with her friends. And now all she wants to do is stay home and study. She's so worried about not doing well. She wants to get into college. She's lost 10 pounds. She exercises probably 2 hours a day. She gets up in the morning. She goes on the Stairmaster, the treadmill, whatever it is that we have in the gym downstairs. And then she goes to school, and when she gets home, she does it again. What's going on here?
Well, there's a lot of concerns there. Certainly, you know, one thing just to sort of check out the most serious one is, somebody who's starting to overexercise, losing weight. One wants to make sure there's not something really serious like an eating disorder. Assuming that that is not present, it sounds like this kid has a lot of anxiety. And as parents, we need to look at, what is the balance of anxiety? Anxiety is a driving force. As I said before, we shouldn't fear anxiety in our kids. We're all anxious as humans. That's part of our brains. But too much of it paralyzes us. And what are we modeling our kids for? If we're saying, you need to get into these schools, I can only pay for these state schools, and you need to go to one of the top ones. If we are getting into all or none thinking, like, oh my gosh, you have this teacher, how are we going to possibly pull out an A this year? If you are going yourself into these what are called faulty thoughts, that's going to be the framework for which your child sees the world. And how can you reduce the level of expectations that no matter what, you'll be okay? There's different paths. People who want to achieve at a certain level can eventually get there no matter what. But it is not worth it in this family. We're not going to want you to get so stressed out. This is not good for you, and this is not a way a kid is supposed to live.
It's interesting, and you were saying before how when we start to measure them in terms of their output, their production, their success, and we're just measuring our estimation of what we want from them, and we're not really appreciating what it takes from them to get there. And understanding that really I worked hard even though I got a B doesn't mean that I didn't want to get an A.
Right.
But nobody says, well, look how hard you worked.
And that, when you look at how to motivate kids, that is the most important sentence. And that has been proven over and over. There's a phenomenal book by a woman named Carol Dweck about motivation. I think it was a bestseller, where she looked at all the research on how to motivate people. And there's what is called the mastery approach and the performance approach. Performance is based on ends like grades. Mastery is based on the work and the sense of competence. And if you praise a child's work, like, oh, you work so hard, you can say, man, when you work so hard, I know you wanted that A. You can come out and say it. They're saying it to you, but you work so hard. I am so impressed with how hard you work. You're gonna manage okay. And it's that work that gets people places. Intelligence is achieved. It's something people continuing to work at things, and it's a lot of schools just drudgery. It's hard work and getting through the grunt work. Then they feel more empowered by it and not deflated by it.
And they connect with you better. It's when you say you don't have the skills, you're basically judging me, and you're the one person I want to please more than anyone else, even though I won't never admit it.
Never admit it.
But when you tell me I failed, it is like God telling me I failed.
It is.
And it challenges my whole core of being. And it's real easy to do that as a parent because, once again, we're busy, we're frustrated. We don't want to deal with having to find some way to remediate or to fix things that just are a little bit broken. So sometimes we just resort to exploding our expectations without really having a sense of what impact that has on the child.
And I think there's a critical difference to think about when you think about that toddler versus the teenager and managing those tantrums. When they're a toddler, we can control their environment. We can get them out of the candy aisle. We can decide not to go to Disney World for our vacation since it ends in misery sometimes. We can control things more and control what they're exposed to. With teenagers, you lose control. They are evolving into adults. You can't control them anymore. And when you start to see yourself as an influential adult, as a parent of influence rather than a parent of control, you can see yourself as the most influential person in that child's life without that burden that you can somehow control their future, because they're in charge of their lives. It's their life.
Well, and this also brings to mind the extension here, where you're talking at the same time they have in their brain, in their development of their brain, a fairly, let's say, poorly differentiated filtering process, so that when they react, much like the toddler and the teen, it is an impulsive reaction. It's they're more willing to jump off the cliff into the pond or into the stream. They're more willing to strike somebody or to just do the things that are much more impulsive. And when they're feeling bad and they've thought about how bad they feel and how disappointing they are, suicide tends to be much more common. And it is the second leading cause of death in adolescence.
Right.
The first being trauma.
Right.
The second being suicide.
Yeah.
So we're talking about things more prevalent than cancers or any kinds of diseases, infectious diseases, whatever. That's a big issue.
Big issue, yeah.
So you're talking about things happening, people giving the wrong message, and it's just that moment. Let's talk a little bit about suicide.
Right.
How do you configure that in your mind? We see kids who threaten, say, talk about wanting to kill themselves. I don't want to live anymore. Why would I want to live with you?
Right.
I just want to die. And sometimes you think, oh, you're just making a scene because you want to get out of something.
No, it's always important to explore it. And we get this feeling that it's something if we talk about, then somehow that's going to make them think about it more. But it's always important to explore it and to get a doctor in on the discussion if you're really, really worried. Ask the questions. Tell me, how badly you feel. It sounds like you feel really, really, really badly. Tell me more and really explore it. One of the things when you look at warnings for depression, suicide risk, certainly recent shame, major humiliation is important. And so that's where, as parents, we need to be very wary if someone has made a mistake or if they have lashed out on what we do when it comes to shame.
Well, sure, we see the Facebook exposés on people and their sexuality or whatever it is, and the next thing you know.
It's utter shame. Right. But it's a serious question. Now, they're doing a marvelous job, the American Academy of Pediatrics, doing wonderful job at teaching pediatricians on how to screen for this. And in schools, they're doing a marvelous job as well with school counselors and even teachers in schools. And Fairfax County is doing an excellent job with this, but not being afraid to talk about it. And parents are afraid that they're going to encourage us more by asking more about it, but in fact, it's dismissing it that really is more of a concern.
So let's say in conversation, you ask your child, sometimes you seem sad. Would you say, have you ever thought about killing yourself, or do people ever talk about it? How would you approach that?
Yeah, you want to be careful being too concrete, black and white. Right. You want to get them to talk more. Yeah. Open-ended questions. So that's the skill of the psychiatrist.
Do you ever get so frustrated you want to hurt yourself?
Yeah, or how bad do you feel?
Right.
Do you feel so bad that you want to crawl into a cave and just disappear? How bad? I mean, it's and you got to do it when you have time and when it's not at the height of the emotion. Right. Some kids, it's like, I hate this life. And that's where as parents we go, oh, they're just saying it. But then when things are cooler, when calmer, listen, you said something that made me worry about how much you're suffering. And again, showing the empathy that we like other people to show us. I'm really worried you're suffering a lot. Right. I want to figure out a way to get things better for you. Whether it's we reduce the pressure, whatever we got to do, we got to make it so that you aren't feeling so bad. Tell me about how badly you're feeling. And if you're not getting anywhere with them, that having another adult to help out is important, whether it's a doctor or a teacher.
Interesting and very important things, of course. And when you look at the line of communication that you try to open up, it does really warrant that you take the time, that you show your concern, and that you're non-judgmental. Now, and when we set limits with kids, sometimes we have to sit and really just sort of outline what's reasonable for us. We try to do it at times when we're not emotionally charged. Right. Worst time to set limits, of course, would be when you're at the height of some moment that you are arguing with someone.
And because as adults, our frontal lobes are mature, we have this tendency to want to fix things and solve things and make sure they're all set. So when there's a confrontation, we want this, dealt with, disciplined, outcome done, send the message. We want it fixed right there and then. And in the height of the emotion, can't really solve things. And we know that as adults. If you get upset with someone at work, you're not going to solve anything in the midst of some altercation. It's going to be later on discussing, is this the right work environment for you? Not like, you're fired.
Right.
But so that you're able to not have that emotion, because that emotion only messes more with the front part of the brain, and none of us are good. Now, during that time, even adults. Now, the trick is that with teenagers, they often, when they want something, do choose the worst possible time. And being able to say to them and not try to solve it right there in the moment, whether it's, I really want to go to beach week. I really want to go to beach week. We got this house right now. Everybody else is signing on. We're going to lose the lease. We got to do it. And you are in the middle of driving to a meeting, or you are in the middle of something very important, whether it's for work or something else in your life. Being able to say, we can't fix this right now. And they're escalating, getting more and more upset. But this is so important. I can see this is so important to you that we need to dedicate some more time to talk about this. Clearly, this is so important to you. So you're validating, it's important to them. You're not just shutting them down, but also doing it at a time where you're not going to be at the height of the emotion, where you're rushed or where you're upset about something.
Yeah, very, very dicey, very difficult, very challenging moments as a parent, for sure. Setting limits and understanding where and how to impose them, and not being taken advantage of at times when you can't really respond to them, is truly one of the more difficult and important things for you to start to understand. And seeing a psychiatrist is a good thing. It's not something that connotates that you have necessarily something really bad going on, but often seeing someone like you who's refreshing and insightful to help people figure out how to best address their kids is really an important thing, I think. And certainly there are pediatricians, family practitioners, and other doctors who can help families in that situation.
Absolutely.
Anyway, I hope you were able to grasp something out of this. I think that this is the kind of thing that we could talk about for days. And I do hope that we have another opportunity to have Dr. McCarthy on the show to do that again. But in the meantime, I do thank you for watching, and until the next time, I am Dr. Russell Libby, looking out for your health.